In a world increasingly shaped by technology, the HumanUp Imperative explores the significance of human connection with each other, with the communities we serve, and perhaps most importantly, with ourselves. Join Rex Wallace and his guests as they discuss the ever-important role of authentic, meaningful connection in healthcare. It's time to Human Up.
Hey, welcome back, everyone, to the HumanUp Imperative. I'm your host, Rex. Today, we're going to actually take you inside human connection. And we want to take you inside because we want to explore, well, at least what I see as one of the very important connective tissues that without which authentic human connection cannot exist. This is a connective tissue, if you will, that's really having its day right now, having its moment. It's in virtually every member engagement presentation, every customer experience presentation, every white paper. And it's worthy of all that attention, but I really don't think we're doing it justice. I think we're just barely scratching the surface on how important it really is, and even what it really is. It's not AI. And that seems to be a big buzzword too, obviously, but this is different. This is something that's necessary for connection. It's trust. And I would describe today's guest as a trust enthusiast. I like that a lot, and I think that really fits her. She's also an industry expert and in sort of all things experience, and she works for the market leader in understanding and teaching us how to improve the connection between humans and institutions. And these are retail, hospitality, airlines, government, right? So the citizen experience as well. But we're focusing largely today on the healthcare side of it. So the healthcare experience. So super excited to have her on today. Let's get ready to human up with Amber Maraccini. Amber, welcome to the show.
Thanks for having me, Rex. Happy to be here.
So glad you're here. Can you, I gave you like a 10-second introduction here. Let's do you some justice though. And can you take, a few seconds, 30 seconds or something, and tell everyone a little bit more about, or you can take longer than 30 seconds, but who is Amber Maraccini? What's your story?
I'll keep it short. And thanks again for the opportunity to share. I think at my core, I'm somebody who is deeply committed to making healthcare more human. So obviously makes sense to talk about this within your podcast. I lead our healthcare practice at Medallia, where we empower organizations to better understand the human experience and build lasting trust. That has a huge piece when you're talking about connective tissue. We like to talk about Medallia as really the nervous system, right? And how we are understanding signals that are coming in across the healthcare journey and helping organizations to action on those signals. So in that work, we have the privilege of collaborating with thought leaders like yourself and your organization, Rex Wallace Consulting, and others like the Arnold P. Gold Foundation that works on advancing humanism in healthcare. On a more human note, for the sake of your podcast, I'm married to my high school sweetheart, who also spent his career in healthcare, and together we're raising 3 amazing boys, all under the age 5. Which we like to say we have a fun household. And
I don't hear them yet.
Yeah, exactly. And my mission in healthcare is just a bit more personal. I know you are aware of this, but just for your listeners, I lost my dad in 2024 to late detected and possibly preventable cancer. And that loss is really what fuels my purpose to make healthcare more human and more trustworthy, and really just more worthy of the people that it serves. So I think that's how our paths crossed and how we connected today.
Yeah, it's you mentioned we do some work together, my company and your company, and that's been very valuable for us. We've learned a ton about all things experience through you guys, and I've loved working with you. So really glad this worked out, and I think you're the perfect guest to kind of unpack trust, right? And I mean, we want to dissect it, define it, and and I think reframe it a little bit today, right? And help people understand a little bit more about that. So, and maybe we start there, just kind of high level. How would you define trust?
When I think about trust, it is really more of this belief that you will be seen, heard, and cared for. I think, especially in the times when you're most vulnerable. And I think that's why it is a topic, a belief, a feeling that has strong relevance in an industry like healthcare, where the stakes are very high and you tend to be most vulnerable.
Where would it fall in Maslow's hierarchy of needs?
Yeah, so I love this idea around Maslow's hierarchy of needs, right? And if you're ultimately trying to get to self-actualization at the
Yeah.
top of a pyramid, I think it actually is, and I'm going to go back to the connective tissue, but it is what holds that framework. So maybe more of the scaffolding that holds the pyramid together, right? You have
Yeah.
at the core that feeling of safety. And in order to have physical safety, then we can move on to a sense of belonging. But in order to have trust, you really have to have a framework that is sturdy across the board. So the trust in that you will be physically safe, right? The trust in that you will feel belonging in order to get all the way up to the point of self-actualization.
Do you think it's black and white? So I trust you or I don't trust you. Are there levels or shades of trust?
Yeah, we can 50 shades of trust, right?
Yeah,
We can
right.
we can talk about it that way. But when we look to trust, I do see it as a spectrum. It is not something that has to be binary, and I do see trust as something that is continuously evolving. We hope that we are making decisions and engaging with patients in the community every day, that trust continues to grow, but it can also be eroded over time. When we are picturing trust along a spectrum, I think you have something along the left that is much more fragile and something that
Mhm.
is much more long-standing. And so the individual behaviors can kind of move that scale one way or the other. And you can also have very traumatic or more substantial events that can completely erode trust entirely.
So when you say entirely, you think even as a maybe not as like maybe not a person to person relationship, but I guess even that too. But
Hmm.
I think we're talking, at least from a human up perspective, we talk about you connecting with me, you
Hmm.
connecting with your community, and you connecting with yourself even, right? So I think trust plays a role in all of those.
Yeah.
Um, obviously you as a customer too, right? Or a member or a patient or, kind of whatever the title is for the role you're playing as a consumer. But do you think it can be eroded permanently?
I think that there's always opportunity for it to be repaired, but it
Hmm.
takes vulnerability, acknowledgement, and consistency in the behavior change. And I think the way that we engage with each other as humans, the way that we engage with our partners, the way that is very similar to the way that we would build trust or trust would be eroded with organizations,
Should be right.
right? I
Yeah.
think it is very much agnostic, and it's a practice of, is this organization showing up consistently? Are they doing what they say they're going to do? And so on and so forth, in the same way that you would develop relationships and trust with the people that are most close with you in your life.
Hmm. And I have a host of questions, and I probably won't ask them all. And I'll give a shout out to Steph and our producer who actually came up with some of these too, because we had a great discussion around this topic when we started teeing it up. But
Hmm.
one of the questions is, on the positive side. So if you are building trust
Hmm.
if you're really good at building trust with your customers or your patients or your members, can that unlock higher emotional states like loyalty and advocacy from those people?
Oh, absolutely. I think trust doesn't just unlock loyalty. It going again back to that pyramid, right? That hierarchy it needs. It helps to create a emotional safety. So it invites honesty, connection, and partnership. And I think this is why we see so much
Mhm.
linkage between trust and engagement, for example. When you have a space where there is emotional safety, you're also willing to provide feedback and proactively reach out because you feel like your relationship is valued, right? And that's not just in the sense of a personal connection, but in the way that you're engaging I mean, in my experience with a health plan, right, or a healthcare system, you don't want to continue to share feedback that you don't feel like anyone's ever attending to. And it's the same way that you would engage in a trusted brand. So we are a Marriott family, right? When we go, and especially traveling with 3 little kids, there's a huge piece of expecting consistency and reliability and right, that follow up, so that we know that this brand itself is something that we trust. And each of the stays, no matter what city or country that matter that we're staying, we still have that same experience with the brand overall.
Mm-hmm. And if you take that sort of that whole concept into healthcare, where it feels like experience and relationships between the member or the patient and their provider or their health plan or their pharmacist is supercharged, right? Would you agree? And
Yeah.
can you unpack
I
that a
think
bit?
it's supercharged because the stakes are supercharged, right? The stakes are higher. So it's not just about being willing to reveal true vulnerable feedback about the stay that you had at a hotel. The difference is you are sharing information. You're more likely to share information with your provider that only you yourself are privy to. And you're more likely to ask questions about the spot that you noticed on your body or the feeling that you might be having in your GI system, or something that you only know yourself you would be experiencing. And that's a huge piece around why, when we're looking at experience, it's deeper in healthcare. We are really looking at the relationship, the trust between patients and their providers, patients and the healthcare brand overall, because all of those moments and touch points impact ultimately how willing they are to be vulnerable and engaged in their care and in their care plan. So ultimately, when we're having these conversations, we do see, and data does support, that when patients do demonstrate trust with their providers, they're more likely to have stronger health outcomes, whether it's early on detecting something that can be prevented, or just changing some behavioral practices that they didn't have the education to start engaging in post visit, right? They're more likely to adhere to medication protocols. They're less likely to end up readmitted into a hospital. So it's in the best interest of everyone in those rooms.
Right. I read somewhere, maybe it was a white paper, but it said, so on the negative side, when something bad happens, especially in healthcare, probably in other sectors too, but this was about healthcare, that social pain equals physical pain. It's the same feeling to a person having, a bad social experience with, with a relationship, especially in healthcare. It's just like getting hit, getting hit with something, right? It causes physical pain. Can you unpack that? Are you familiar with that?
Yeah, so I remember I remember teaching this at University of Nevada, Reno, and some of our psych
Oh wow.
courses. But research does demonstrate that social pain activates the same neural pathways as physical pain.
Hmm.
So when someone does feel dismissed, devalued, or misunderstood by their health plan, for example, it doesn't just frustrate them, it actually does wound them. And it's the same type of impact when we're, when patients are having one-on-one conversations with their provider, particularly when they're opening up and having that willingness to be more vulnerable. The wound there is actually deeper. So that type of additional stress and disengagement that it does create then has a negative impact of this kind of ripple effect, where it's not just how it impacted that initial conversation, but how they continue to engage in their healthcare post leaving that office that day, or post being discharged from the hospital, right? Um, as much as possible, we have to create a positive relationship between the way that we're listening and understanding and reacting to feedback across the entire healthcare continuum.
Yeah, and I feel like recovery. I know you guys do a lot of work around service recovery, and like,
Yeah.
you know, you can, like you said earlier, right? Like you can usually repair these things, right? If you're not sitting on them for nine
Yeah.
months, right, and waiting on maybe a survey to tell you that something bad happened. How, and we'll get more into like,
Mhm.
action later. I know you're big on, kind of leaving a presentation with here's what you can do tomorrow, right? Or here's what you
Yeah.
can do next week, right? So
Yeah.
we'll get to the tactics and some more action, I know. But for right now, I'm curious, how do you what are some of those maybe non-obvious or not quite so obvious silent signals that you talked about, the nervous system that Medallia kind of assesses, watches, monitors within an organization, to see kind of when these pain points are happening. What are some of those maybe not quite so obvious signs that a member is not having a good experience?
Yeah, I think one of the misconceptions here is oftentimes there's a belief that trust is lost through mistreatment, right? So we did
Yeah.
something intentional when in fact it often ties more to the absence of information or missed signals, unanswered questions, delayed responses, right? And oftentimes that does happen within health plans. So those gaps are what can have the real consequences. When we think about how do we listen then, and what information are we engaging and can we learn from our members or our healthcare or our patients on the healthcare provider side, is what are the ways that your patients are engaging with you beyond the bedside that we're not needing a survey to hear from them with. So contact center is a huge opportunity where it really is your pulse for what your patient and members needs are, and they're giving you all of this conversational data that are telling you, here's what I need, here's what I'm unable to self-serve, or here's questions I have that we really have to continue capitalizing on, because with technology today, and I know we're not having a lot of conversation on AI for today, but
We're going to touch on it for
we
sure.
will. So maybe we're just planting a seed for later, but
Yeah. Yeah.
it does give us the opportunity to analyze tone and sentiment, right?
Yeah. Right.
And emerging themes. So COVID-19 is a fantastic example. Was a devastation for healthcare, but from a learning perspective and what we could gather
Yeah.
in conversational data, this is a great example. This is a topic that was never being discussed before through contact center, but with all of the language coming in around COVID and masks and safety, right, and quality, there is this emerging volume all around this topic that is signaling to the health system, we have to do something to address this, right? And all of that is information being provided to your health system without even having to survey patients. So how are we learning from the way that our patients and members are engaging in our websites and through our other channels where they're giving us all of this information that we aren't currently leveraging and learning from?
Yeah, one of the things I've definitely learned over the years is, especially working with health plans, right? They have so much data that on every member, right? That they really don't have to survey for anything because they have the right signals
Yeah.
already that tell them, I think, anything a survey is going to tell them, right? Now, I don't know that we'll ever convince a health plan you don't have to do a mock survey, or because
Yeah.
it's just sort of ingrained in the, it's conditioning and this is how we do things. But really, like, if you just, use all of this unstructured data and this, tap into your call center recordings and all of
Yes.
the data that you have, appeals and grievances and claims and yada yada yada, how these members are doing, right? You know if they're happy or if they're unhappy, at least regarding their experience with your health plan. Yeah, in AI, I know. So two things on AI. So one, kind of where you were going, AI, I definitely believe is a huge. I use AI all the time, right? I mean, I
Yeah.
use Chat GPT for like several times a day usually. It helps me with a whole lot of things, and I know it helps a lot of organizations, yeah, in all these kind of automation and gathering data and
Mm-hmm.
helping
Mm-hmm.
to glean insights. So I know that is, and maybe I'll pause there and let you say more about that. I know it plays a huge role going forward in just take a health plan. A health plan's ability to kind of synthesize data, big amounts of data and pull out quick insights.
Yeah. Yeah, I think there's, in healthcare, it's a unique industry because there's this heavy reliance on mock surveys, on external benchmarks. What are we publishing across the industry, and how other organizations are doing? And I think those are important for value-based purchasing and regulatory purposes. But for those health systems and health plans that are interested in driving change, the most effective way of doing that is getting to know the nuanced needs of the community that you serve, right? And so it's always great to have that kind of thermometer to see how the rest of the industry is doing, the best ways of understanding your population that you serve. And what's critical here is the patients and members who are interacting with your health system, they are only patients and members for a very short stint of their day, right? But they are consumers in the way that they engage with brands across the board. So I think there's also just been this movement of more of a consumer-centric understanding of the way that we're engaging and providing feedback. I'm going to get to the AI point here and how we're summarizing this, but when we think about that and the lens that we're placing on the way that we're understanding, we need to leverage more of that short, modern, smart approach to collecting feedback. So instead of asking this 30-item survey where we may not capture the priority of that human, instead, how do we ask an unstructured question, whether it's video, text feedback, an audio recording, so it's efficient and effective for them? And then you need to have a vendor of some sort to support those capabilities to then transcribe and pull the insights that you need, which does require AI, right? In order to generate, here's the top 3 things we're hearing, and here's what we need to focus on in order to drive change overall. So if we want to keep that external understanding of where the industry is, but also drive changes needed for the nuanced populations that we serve, we have to be able to leverage technology today to drive how we're soliciting the feedback, but then also uncovering what are the most critical actions we need to be taking to drive that change.
Right. Totally agree with all of that. So AI plays a huge role in helping us to improve, right? Helping us to understand our membership better, our patients better, our members better.
Yeah.
By understanding all of that. I'm curious your take on, and this is okay. So the picture that we just painted is AI playing an important role. It's helping to actually equip us to be better at building trust with our members, right?
Yeah.
Now, one of the very reasons we launched this podcast was because of AI not doing that, but replacing humans engaging with humans, right? So I'm a member engagement vendor, and I'm a health plan, and I'm getting rid of my outreach teams, and I'm only leveraging some form of AI to conduct outreach to my members, right? Maybe that's okay. It doesn't feel like it's okay to me, right? I know it has a role. I know it can definitely help in the engagement. It can play a role in the various engagement outreaches, but to not have human interaction it kind of goes against at least everything in me, right? That it kind of screams, hey, this is going to fail, and this is not going to build trust. So my main question for you here is if I'm a health plan member, and maybe it's different for a Medicare Advantage member versus a Medicaid member or a commercial member, but am I going to trust my health plan more or less if all of the outreach coming to me is artificial?
So from the studies that I am seeing, actually AI is helping humans show up better in healthcare.
Humans, members,
right?
and patients. Okay.
Yeah. Yes. And the examples that I'll share and cite is by on the provider side, for example, we're actually seeing agentic scribes, right, or ambient listening devices providing dictation of patient-provider interactions that are showing much more empathetic notes around what the patient is sharing and much more complete, right? Holistic encounters of the conversation happening between patients and providers. And on the health plan side, helping to automate a lot of the processes that help impact trust. So we talked about it's not a mistreatment. Oftentimes it's usually the neglect or delays, right? The times of uncertainty that it takes for a health plan to get back to a member that is impeding trust and impacting in a negative way. And by helping to streamline efficiency with prior authorizations and a lot of the process where unfortunately we still have fax machines,
Right.
still taking in, authorizations to be processed. And that is really slowing down and requiring the humans to manually move and scan fax requests and back and forth. So the fact that AI is being able to use to enhance process efficiency, to help reduce administrative burden is, I think, allowing humans to show up more effectively in the ways where humans can be more impactful. So I think it's just a really exciting time for healthcare to take advantage of these changes, and it's allowing for more of that human-to-human connection when it matters most.
Okay, well, that's encouraging. Good, and you're reminding me of when I worked at a health plan years ago, we were considering bringing on a vendor that had created like a tabletop robot head, right?
Yeah.
Not a literal head, but it was like some kind of device that served as a robot that would talk to the Medicare member throughout the day, and it learned. It was essentially AI, right? So it would understand when the member's medications were due, when they were supposed to take them. It would remind them throughout the day. The member could ask that device questions, and it was sort of resembled a person, right? Like it was some sort of device that sort of resembled maybe a bust or something, right? And in the studies they had done, we never moved completely forward with it, but in the studies they had conducted, they found that members actually would confide more in that device, that artificial bust, than it would with a customer service rep on the phone, because it didn't feel judged, right? So I know there is some truth to there is some truth to AI helping to enhance relationships between members if it's done correctly and appropriately, and maybe I'm just being
and consistently.
Yeah,
right. No, and I think it's the same practices. So, and the way that trust is built in a human to human connection, I think those same practices and behaviors, behaviors, whether it's an AI bot or engine, or it's I recently was at a restaurant here in Reno, and they had a little robot actually delivering the food to the table, right? Which was really great. And I think if that happens, the first time it kind of catches you off guard, but through consistent food delivery experiences where I'm getting the same thing, I got my meal that I've ordered every single time that I go to this restaurant, that trust builds and builds and builds, right? But the one time it brings you that wrong plate, it is a quick eroder of trust, right? And so I think it's the same type of practice in the way that we are engaging with AI, even as a consumer of a health system, and with the same consistent show up and with reliability, I think trust will continue to be built. As an industry, we must continue to lean in on leveraging AI where we can help improve process efficiency so that humans can still have that human to human connection, but in the moments where it's most impactful.
Right. That makes sense. Can you, so as we think about, since we're talking about sort of customer service reps and outreach people, let's talk the connection between CX and EX, right? So between the employee experience, which I know Medallia has, huge investments in customer experience, obviously, but also employee experience. But can you help some of our listeners maybe connect the dots between the importance of the employee experience and the influence that it has on the customer experience?
Yeah. Institutional trust lives in culture. If your employees don't feel safe or valued or empowered, your patients and members won't either. It's this is an industry, and I interact quite often with one of our other industry executive advisors who has such a strong breadth of EX experience. You've met Melissa before, and she has shared with me that healthcare, going to an industry conference in healthcare, she was blown away because this is an industry that gets it. She doesn't have to sell the importance of understanding the relationship between EX and CX as she does with other industries. So this is a vertical that really does get it.
Which surprised. Well, I was in one of the meetings when she said this, and I think our whole team was like, "What? Really?" Like she.
Yes.
But I get it, yeah.
And I think that's because there's the stakes are so much higher in this industry. So not only do engaged clinicians provide better patient experiences, right? They also have better quality health outcomes. So when we look and compare nursing units and we start correlating all of these different variables, higher quality outcomes, higher engagement, it goes hand in hand, right? And it's the same thing when we're talking about financial incentives and how it's driving overall performance. All of these, I'm getting a picture of how my kids color, right? Everything is just kind of mixed. There's no clear separation here between these variables. And I think this is where one of the areas where healthcare has a lot to learn from other mature industries like hospitality. And I mean, as a role model for CX, EX, I think the Ritz-Carlton just does it best when they talk about the ladies and gentlemen of the Ritz-Carlton. And I remember going to a leadership training with them years and years ago, but they had shared how every employee, no matter their role, is given a budget that they can use without needing approval to resolve a guest issue. So if I was a lady of the Ritz-Carlton and I was cleaning a bathroom and a perfume bottle broke, I'm given a budget that I don't need approval for to go out and make sure there's a new one replaced by the time that guest gets back to their room, right? And so in healthcare, I think we talk a lot about if you see it, own it. And we're talking about the call light, right? In most cases, we can't even get ownership of a call light, right? You just walk right past it. But in hospitality, we have empowered employees because they're given the tools and resources to resolve that issue, where oftentimes, unfortunately, in healthcare, we're sharing metrics about how these teams are not performing, but then we're not giving them the tools they need to actually make any change. So that in and of itself really impacts the relationship between feedback and how to receive the information and the desire to improve it.
Yeah, so well said. And couldn't agree more with, culture is a huge part. I mean, our whole tagline at our company is, catalyzing cultures of quality. So it's all about organizational engagement's kind of the number one thing that we always end up doing, no matter what the scope of the engagement is. The solution has something to do with organizational engagement typically. So I agree so much there. Before we get into the sort of the tactics, can you spend a minute on measurement? So if you're talking to a health plan on how do you measure trust? I guess I'll ask you, what do you tell them? How do you measure trust?
Yeah, I think there's a variety of ways that you can measure trust. I mean, I've seen healthcare organizations simply ask the question, do how likely NPS is one, right? Overall, if you're trying to get an overall understanding, that is kind of a parallel way of looking at recommendation and trust. But do you trust this provider? Do you have trust for your health plan? The Arnold P. Gold Foundation is a wonderful organization that Medallia has partnered with. And we've actually developed a trust scale that focuses on specific behaviors that the provider demonstrates that create to this overall trust score. And then the way that patients can rate the interactions between providers that ultimately lead to trust. And I think outside of that, really, there's a language really that we know that can help drive trust around the communication, feeling valued, feeling understood, getting the time that you needed when you were actually speaking to the provider and sharing your opinion and engaging in your own care. And I think that is really when we talk about more of this consumer-centric approach to listening and understanding, that is where I see a lot of the industry shifting, is to the unstructured feedback. So what are we hearing around the language being used to describe the interactions, and then the sentiment around within that language, right? And so there's some really important areas around the unstructured feedback that your patients and members are already sharing with your health system that we can easily be leaning into through leveraging AI and text analytics capabilities that'll give you the message and identify what are the areas you need to change in order to drive trust.
Great. Okay. And once they learn how to measure it and start trying to drive it, what would you kind of end this part of the presentation on, this part of the discussion around, what are the 2 or 3 or 4 things that you advise health plans to do or organizations in the healthcare sector to improve trust?
Yeah. So if I were to ask, you are CEO of Health Plan A and asked me, what is something I can start doing today? I would say, CEO of Health Plan today, get on a call. Actually step into your contact center or step into your healthcare provider system, a self-pay call center even, and listen to a conversation so that you hear real time. What is the interaction, the tone, the sentiment, the dialogue happening that is causing patients and members to call into your organization today? As much as possible, pull in the feedback and the true voice of the community that you serve into your executive and strategic calls, whether it's a way that you're kicking off or starting a conversation, but making sure that you're keeping a patient or a member at the center of why you're doing the things that you do. I've even seen it as much as having a chair dedicated for a patient, even if the patient is not there. Ideally, it would be a patient family advisory member, but even an empty chair, right? A seat at the table so that they are included in your discussion. The next thing would be making sure that you're closing the loop and we're learning from and having these individual service recovery moments and documenting them in a way that we can aggregate and find out root causes so we can prevent those issues from happening in the future. And then the third piece would be to empower your people. So think about if these are our issues, and when we go and talk to the front line, what tools do they have to actually resolve them? So again, going back to the Ritz and ladies and gentlemen of the Ritz-Carlton, can those perfume bottles be resolved without leadership intervention? Yes or no? If the answer is no, how do we fix that?
Perfect. Those are great. And let's I have a few more. Let's consider these rapid fire questions, right? So we'll end with a few of these. And I like asking all of our guests these kind of similar questions. But what's one book you would recommend that everyone should read?
My favorite book of all time is Dare to Lead by Brené Brown. It's a fantastic book on courage and vulnerability. And I think my most key takeaway is she talks about this act of permission slips. And I think a lot of time people are waiting for permission to action. And if you need to give yourself that permission, then go ahead. But at the same time, just assume permission slips are there and available. Go take action.
Right. I love Brene. I'm here in Houston where she is. And I don't know if it's in the I've read Dare to Lead. I'm not sure it's in that book or one of her other books, but where she says, clear is kind, unclear is unkind. We say that a lot. And I think if you're trying to build trust, right? Like I think you can pretty much open any page of a Brene Brown book and find a tip on, hey, this is something I should be doing now, right?
Amazing podcast, and she's an amazing voice to listen to on audio as well. I really enjoy her books.
Okay, so let's get vulnerable here. What was your most helpful personal failure?
So this one is hard. I've listened to your other rapid fires from your other episodes, and one that came to mind for me was making sure that my behaviors aligned with what I'm communicating and advocating to my team. So it was really a leadership lesson for me. In this situation, I had continued to talk to my team about the importance of balance and how to make sure they unplug when they're on PTO. And I came back from a Disneyland trip and I had an employee sit down in our one-on-one and she said, "Hey, I just wanted to talk with you. I noticed you were replying to my emails when you were at Disneyland and we all knew you were at Disneyland." And I said, "Well, yeah, absolutely. It was just a quick question. I wanted to make sure you had what you needed." And she shared with me, "Yeah, but it made me feel like if I was with my family at Disneyland, that you would expect me to respond to that email." And it really clicked in my head that even though my intention might have been pure, really how I'm leading really sets the expectation of what my team thinks I would also expect of them. So it was an important moment that I continue to take with me and help shape the trust and boundaries, expectations that I set.
It's a great one, and I think it's one that a lot of I'd say good leaders struggle with, right? So because you want to be there for your team, but you also want to set the precedent, right, and set the example of what's expected of them, right? So it's such a good one.
Yeah.
So thanks for sharing that. What's a belief that you swear by?
I strongly believe in creating your own opportunities. And I think it's very easy to kind of sit in a rut and be unhappy about a situation. And so I always ask the question, what have you done to make it different?
It's good. What's the hardest decision you've ever had to make?
The hardest decision that I have to make is something that honestly, I don't think it's a single decision. It's something I struggle with daily. And I think it is probably why I'm very attracted to Brene as a speaker, as an author, but it really deals with vulnerability.
Mm-hmm.
And I think there's a lot of challenges that come into the workplace, into your home life, and just admitting when you don't have it all together. And as somebody who I've, being in control of my situation has been a coping mechanism for me. It helps me kind of manage through tough times.
Right.
And I think when lots of plates are spinning at once, really taking a minute to share with the people you love that, like, I don't got this is something that has been really challenging, but has always been, I'm surprised at how much people appreciate when you're willing to be vulnerable about that. Because again, kind of like with the PTO example, it creates a space where other people are more comfortable coming to you saying, "I don't got it now. Can you help me?"
Right.
So yeah, I think that's a big one for me.
Yeah. Being vulnerable, and I think of her, and I think of any kind of I'd say I've had leaders kind of use shame-based leadership too, right? And when I think of her, I think of shame as well because she's does all the research around shame. But vulnerability and it's hard, but it's so important.
Yeah.
Kind of related. So, were there events or successes or failures that made you the leader that you are today?
I the first thing that comes to mind for me is watching others lead. Has always been, just as somebody who loves understanding human behavior and why people are the way they are, but also the impact that they have in a room. I'm the product of strong leadership and strong mentorship and poor mentorship and poor
For
leadership.
sure. Yeah.
Right. So,
Yeah.
I think there are moments that are coming into my mind clear as day right now, in a boardroom when I see people walk into a room and the impact they immediately have. And I think how you start a conversation and relate on a human note is a shared characteristic that I've seen across the leaders that have driven most impact. And so when I think about these moments and how they boil up to this bigger perception that kind of guides the way that I choose to lead now, I always try my best to connect on that human to human level before you're starting to jump into anything further than that.
Yeah. Yeah. Building trust before you start trying to, have a committee meeting or execute or make a decision.
Yeah.
Before you've even built trust is always a mistake. Yeah. Okay. Last question, at least last interview question, right? End with this. How would you finish the sentence? For me, one of the most important ways to human up is to
lead with curiosity.
Perfect.
I think being curious, instead of just assuming intentions,
Yeah.
Being willing to ask and wonder, and it can range from everything from you're never the smartest person in the room. There's always something to learn, to the person who's driving like a maniac on the freeway. Instead of just assuming intentions, you are curious about, what could be going on in their day that is impacting this situation now. So I think it just creates a different level of being able to connect from human to human.
Yeah, it's a theme. I mean, if you listen to episode 1, right, Todd Ray talked a lot about curiosity and, as a leader and how it helps him connect with people and to be curious so that and they don't feel like he's just micromanaging, right? But he's genuinely trying to understand so everyone can be better. And the more curious, if we're not curious, we never really realize what we don't know, right? Or what our organization doesn't know. So it's so important. Amber, okay, so if people want to follow you or learn more about you, or like where can they find you?
LinkedIn. They can reach out to me on LinkedIn, and I'd love to set up a coffee chat or have a human dialogue.
Hey, not AI?
Yeah, that's fantastic. I'm excited. There's some upcoming industry conferences that we'll be at, and I'd love to have some in-person conversation if available, or if we're able to, but also virtually through LinkedIn is a great way to connect.
For sure. Any last words? Anything we missed that you didn't get to say that you really want to say?
No, I loved the conversation and the opportunity to human up with you, Rex.
Hey, me too. You did so well, and it was a lot of hard questions, I felt like, and you knocked them all out of the park. So helped us unpack trust a bit, and digest it in a different way, and understand how important it is. So Amber, thanks so much for being on, for Human Up and with us, and we will talk to everyone next time. Thanks so much.
Thank you.